Good morning, everyone. I'm Megan Culp, along here with Scott Micklin.
Good morning. It's Wednesday, June 17th.
June 17th.
Good to see you.
Good to see you.
Don't look a day over whatever you were yesterday.
Yeah.
Even though you've had a birthday.
Right.
Yes.
I don't divulge ages on the air.
Okay. Timeless.
I'm
like me.
I'm timeless.
Yes, exactly. Here we are. But anyway, you had a good birthday, and so it's good.
It was good.
Yeah. So welcome back.
Thank you.
And here we go with local information. COVID-19. We're back with everybody. Thank you, everyone, for joining us again, because we've got some important information to share this morning. We're going to be talking to a couple of folks who are going to call in today. First and foremost being the one and only Vince Moffett.
He is the one and only Vince Moffett.
There really isn't anyone else like him. If you've met him, you would know.
You would know what we're talking about.
Yeah.
The Rubicon Vince Moffett.
Right, based on health companies.
That's right.
Vince Moffett. So
right.
He'll be calling in, talk a little bit about the work that he and his staff are doing and some of their observations about the coronavirus here in the area and those types of things. So there's that. And then we're going to talk investing a little bit with Jason Calcote later in the show from Citizens Trust Investment Corporation, because if folks have been watching maybe their 401ks or if they're just some stock investments or whatever, they may see...
it can seem pretty scary.
Yeah.
So it'll be helpful to talk to him.
Right.
Because there's a lot of ins and outs to that kind of stuff.
He has a very calming demeanor.
He does, actually.
Which you want to have in a, trust officer.
You do.
Yeah. So he's going to be calling in later
I've just
as well.
buried my head in the sand for a bit.
Did you?
Yeah.
Yeah.
I mean, I know about markets in general, but I don't know about the status of my own.
Right. There you go.
Like, I don't need this. Close the laptop.
Well, that's what I think what he will say is if you get worried about your investments, then maybe you're not invested in the right stuff, because you should be able to sleep at night.
Could be.
It's the idea.
We'll see what Jason says.
We will see what he says. Indeed.
Yes.
So anyway, so that's what's been going on.
Good.
So, yeah. Numbers wise,
let's look at numbers.
We can look at numbers. You've
find
got your
the national
numbers. Look, you're still getting birthday greetings on the screen there.
How
mean, about that?
People have been so good. It's amazing.
Right.
Right. You know what? I don't think the numbers came through.
Well, okay.
This is shocking. Come on, Johns Hopkins, get it together.
Right.
They must be wearied.
That is weird.
Because normally they're on it.
Yeah. That is a little bit strange, but let me show our number. We have local numbers. We can do that. Okay.
Let's do it. You got it?
While you're looking. We do, as a matter of fact. Here they are. From the state, 88 new cases yesterday across New Mexico. We're at 9,933. San Juan County cases, I think, are notable because we only had 6.
That is notable.
New cases yesterday.
Notable.
Now, again... These daily numbers, it's kind of hard to keep them in context because some days are higher, some days are lower, but 6 is pretty good. 7 deaths across our state, 440 total, and 3 of those were in San Juan County, so there's a total now of 150 folks who have lost their lives from COVID-19 and 57 additional recoveries across the county. So I think that's notable as well, across the state, I should say, recoveries. As we scroll down, we can kind of see, again, and we're looking at this from ksje.com, we've got a special COVID-19 coronavirus news section of our website dedicated to information about the virus. So the daily New Mexico statistics are there. Also, the updated Navajo Nation numbers are there. They had 39 new cases across the Navajo Nation yesterday. That number, again, seems low to me.
It's lower, although they are reinstating the curfew.
The 57-hour curfew over the weekends.
That's right.
Correct. For the next 2 weeks.
That's right.
I understand.
Yes.
So that's happening this week, everyone, beginning at, 8 p.m. Friday?
Yes.
Until 5 a.m. Monday. But their total is now 6,672 cases across the Navajo Nation, and 8 additional deaths reported yesterday for a total of 319. And so that is happening as well. I also want to point out that the Department of Health has unveiled some more testing. Of course, we know that testing is happening at 6 p.m. this week at both the Kirtland locations today and San Juan College tomorrow at 6 p.m. And there's also going to be a testing on Saturday here at San Juan College.
Oh, good. That's a new addition. Saturday?
That is new. Yes.
What time on Saturday?
I'm just going to look that up right now.
Okay, cool. Johns Hopkins is failing me, which is rare.
I'm sorry that's happening.
I know, because I'm obsessed.
Right.
I love this website, but I'm not...
Surprising. That they're failing.
Oh, I thought you were going to say it's surprising that I love the website. It's not surprising in any
nothing
way.
You say surprises me at all, ever.
Which is kind of weird, because I think it does for others. Wait! Huzzah! I found it. Okay.
Little refresh there?
I found it. Little refresh.
Okay. What do you got?
Okay. As of Tuesday night, 2,137,716 cases of COVID-19 have been reported in the United States, which is a very significant increase compared to the increase. So yesterday the increase was about 19,000. Yesterday the increase was 24,228 cases again, and 116,962 deaths have been attributed to the virus, which is an increase from 840 from yesterday. Again, the mortality rate, they're holding it at 5.5% of those infected will die, or, somewhere in there. And of the 24,449,307 tests conducted in the U.S., 464,715 were conducted since yesterday, and there's an 8.7% positive rate of those tests performed.
Okay. Very good.
Yeah.
Thank you for sharing that. The Saturday tests here at San Juan College will be, it's told to arrive by 9 a.m. Saturday, June 20th at San Juan College for this drive-up event for COVID testing here.
Okay.
So just so folks know. So that's important.
Nice.
We do have a phone call?
Yeah, great. Let's go to the phone.
Shall we go to the phones and see if this is our first guest calling in? Good morning. You're on KSJE this morning.
Good morning, Scott. Good morning, Megan.
Good
Hello.
morning.
Vince Moffitt.
The one and only, as we have said. Great to talk to you, Vince Moffitt from Basin Health Companies. Thank you for calling in.
You bet. I always enjoy talking to you guys. Thanks for having me on.
Well, there you go. Feelings mutual.
It's mutual.
I know, right?
Beautiful thing.
So, yes. So give us an update, Vince Moffitt. Of course, Basin Health Companies, you have a lot of home health workers, folks that are traveling out, dealing with maybe a vulnerable population and things along that line. So can you give us an update of how things are going with your workers and your company and your patients?
Sure. Yeah, so really the big change since last time I talked to you guys is we're just really tired. I think we're working really hard to keep our patients safe and healthy, and that takes a toll on our employees, wearing the gear every day and making sure that we're doing everything to be diligent. And I think the best way I can explain right now is something called caution fatigue. I think we've been going at this for so long, and the community's been taxed too because everything's been shut down. But for a lot of the healthcare workers, I think they're also sick of it, but every day they keep showing up and putting on high levels of protective equipment to go in and see these patients, and so far it's working. So that's pretty good news, even though we're tired.
Yeah, it's definitely become a more tedious world for sure. That's been my observation everywhere I've gone, including my own house. But what about COVID-19 census? Is anybody on you guys' caseload COVID-19 positive?
Yeah, we've had patients come on, they're COVID positive, and through both our home health and our hospice. And then we have some of our families and our family caregivers that have also been positive. Luckily, I've been doing a lot of research. I'm sure you guys have heard about viral loading and viral dosage of the COVID, and the studies revolving around that, where basically the lower the viral dosage that you receive, it's possible that your symptoms are more mild. So unfortunately, we've had a couple of patients have passed away because of COVID, and as you guys know, one of our caregivers and his family, but that has seemed to mellow. And I think part of what I'm thinking anecdotally is by taking steps of people minimizing their movement, staying at home, minimizing the number of guests, and then whenever anybody comes in wearing some level of protective equipment, it's helped with that. We have had some COVID positive hospice patients, which, hospice is always very sad and very hard anyway, but when it's something like COVID, especially when it's something that it seems like it's so mild in people's minds sometimes, and then to have someone pass away from that, I think it takes more of an emotional toll on some of those patients and their families as they're going through that. But we have had a census, and I think I anticipate it's going to continue to kind of fluctuate like we're seeing in our community. It's not going away. And one of the things that I think, yesterday I attended a funeral for my friend Glovis Foster. I'm sure you guys have following that, who was a paramedic.
Yes, of course.
Yeah, and he, I worked with him for years, and I think when stuff like that happens, it kind of reminds all of us in healthcare that it's real and that the steps we take to protect our patients and our staff are so important, regardless of the fact that, we are tired. So, I think that my thought is it's going to be interesting to see what happens with the hospital still running on average a higher than normal COVID ICU load, but eventually that overflow is going to continue to come out into the community. We're working with the public health department on staffing shelters for the inebriate population and for people who can't go home because of their family or whatever when they are COVID positive. So we're staffing that as well. So, we're going to continue to see that number fluctuate, I think. But so far we're able to handle it. The big trigger point, I think, is keeping my staff healthy and all these other facilities keeping their staff healthy, and then adequate amount of PPE, which we're still seeing a little bit of a strain on that, but we are able to get more access to it. But everybody in the community, I think, is important for them to know is we're reusing this stuff still. In America, we're reusing our protective equipment, which we've never been in a situation like that before, and it's still kind of hard to wrap my head around that aspect as well.
Yeah.
One other thing that's pretty interesting is we serve a high Native American population in our census. We go out in different parts of the reservation. We're also in Gallup and Grants. And so watching what's happening in Arizona, Arizona is really spiking, and it seems like that is Arizona. It doesn't really affect us, but it affects us a lot because we'll see those people that have come from Farmington going into Arizona, coming back here, and people are starting to do a little bit less, but as far as, taking steps to prevent it, but that will affect all our censuses as well. So I don't have any hard numbers to give you, Megan, but yeah, we're still seeing them for sure. It's still in our community, and I don't think it's going away anytime soon. That's my message to our employees.
Indeed, when we're seeing that every day, of course, Vince Moffett, with the numbers that are coming in, and it does seem to be going, spikes and lows and highs and lows and things like that. I did want to ask you mentioned the fatigue that I think a lot of folks are feeling, and especially folks in your line of work. Does that concern you? Is there any more training that you're doing, or just reminders to your staff to stay vigilant and stay with the plan and with the PPE and making sure that they've kind of dotted their I's and crossed their T's in a physical way when they're going out to visit with your clients?
Yeah, absolutely. So, to touch on that a little bit, I think that everybody's trying to figure out what level of risk they're going to take in their regular lives. I think at first it was really easy to say, hey, we're going to just quarantine, we're going to stay home, we're not going to do anything. And now you see people starting to go out a little bit more. I tell them they're tiptoeing into the pool. I don't know what level of risk people are willing to take, including my staff. So what we've done is we've just stayed hyper vigilant in making sure that we're using our protective equipment at all times. And, you'll see a positive pop up here and there with a staff member or clinician throughout the community. And it's really a rewarding thing when that does happen to be able to say, hey, we did not spread this to any of our patients. And that's been the case for, I think, every home healthcare company in the community. I work with the nursing homes too, working with the emergency manager's office. I volunteer to work with them when they have cases to work on their isolation procedures and protective equipment usage. And one of the things that you'll find is that really, anecdotally, the mask work, washing your hands work, wearing gowns, changing your clothes before you go see patients and then changing back before you go home, and washing your feet, which, we've talked about that before here too. So as people start to go out, the way that we're trying to reiterate is whenever we see a win, we'll have a contact tracing situation, and we go back and everybody says negative. All our patients are negative because we took those steps to protect them. And that's the thing that people need to remember when they're in the community and they say, well, I'm healthy, I don't need to wear a mask. Well, you don't always know. You may be asymptomatic. We've seen asymptomatic cases, and that person sitting next to you has a vulnerable immune compromised system, is going to be at risk. And so we can influence our success, and we've seen that through our usage the past 3 months of this equipment. So, Scott, I think that's really cool to see, and I hope that other healthcare workers are listening. I feel you. We're all tired. We hate it. It's exhausting wearing this stuff and putting it on, and we're just as sick about hearing about all this. And you add the racial tensions, you add protests, you add wildland fires, you add all this other stuff onto it. But we've got to stay diligent, and it's the only thing we're going to be able to do to protect those vulnerable people out there. And we're taking it very seriously. And I'm proud of our staff because I know we talk about it and kind of have these circles of communication where people just vent to each other. But when they get it out, they all go back to the fact of, hey, we've been entrusted to, with our patient safety and the community safety, and we're going to do this thing. So I think the big thing is communication about those issues. It's real, for sure. We're all dealing with it.
Right. Well, and it's good to hear you say that, Vince. I think a lot of folks maybe don't hear that enough. And as we reopen and see more businesses reopening and we're coming into contact with more of our friends and neighbors, if we want to get out and go back to a restaurant or do some more shopping or those types of things, it's still important to remember the ways that we keep this thing from spreading. And a lot of that has not necessarily changed that much, even though we're learning more information about the virus. There's still things to do, which is keep your distance and wash your hands and don't touch your face and wearing a mask when we're out with other members of the public, right?
Yeah, and I think the problem with prevention and preventative care is you don't know if it's working.
That's right.
Because it's like we prevent these things from happening, and if we don't see it happening, people think, well, maybe it wasn't a big problem before, or maybe it wasn't an issue, and I think that right now, as things start to open up and people go out there, we're not going to see the results of that for a couple more weeks. And when someone gets sick, and I've had this happen in my staff, and I know I've talked to others, same thing. If someone gets sick and you're not taking steps to prevent it of your other staff, then you're going to have to quarantine your staff. And so we have been so lucky that if we had any positive cases, once again, we haven't had a quarantine. It hasn't spread. We can test people. They test negative. So to me, it shows that those things are working. But I know people aren't going to be able to take every step all the time, and they're letting their guard down. And I think that with that part right there, if we can just remember that and say, okay, everybody's going to be at a risk at some point, but if I'm an employee and I have to miss 2 months of work, how is that going to affect me and my family and my staff around me? So we're really, I think in healthcare, that's the part that we got to remember. I feel so bad when people are sick anyway, but when you're sick for 2 months and you're really sick, and that's what we're seeing, yeah, you recovered from that, but you missed 2 months of your life and 2 months of work. And, those are things that make it hard on everybody for sure. So, yeah, it's important to stay diligent. And I will tell you guys both, I mean, I'm tiptoeing in the tool too. My quarantine has gotten a little bit bigger. I went out to eat yesterday twice in local restaurants, and those are things that I didn't do before. But I'm still taking steps every time I walk into my office and I'm working with my staff or we're working with patients. We're wearing high levels of protective equipment. And that's what I think the message I want everybody to know is that these healthcare providers and restaurants and grocery stores, if they're taking those things seriously, support them because they're trying to keep you healthy and still remain in business in our community.
Very
That's
true.
right.
Very true, Vince Moffitt. Well, thank you for joining us yet again and for the work that you and your staff are doing in the community. And you mentioned some of the volunteer things that you're doing with the shelters. And we can't thank you enough. I mean, it's important that we're all in this together, as we've heard time and time again, and it's folks like you that keep us all safe. Thank you.
Well, you're welcome. And, I think that I used to always say this is a marathon, not a sprint, but now I believe it's an ultra marathon. And so,
well, no kidding. Yeah.
I know there's a lot of negativity out there in the news and everything, but unfortunately, COVID isn't going away. So I just ask everybody in the community to be patient with each other and really be patient with these people that are trying to take steps to protect others and going out there and putting on a skier to make sure that the spread isn't growing in that vulnerable population.
Good point. Good advice, Vince. Thank you so much.
Hey, guys, thank you, and have a great week. It's great talking to you as always.
You too.
Indeed. Thank you very much. That's Vince Moffitt, everyone. He is the CEO of Basin Health Companies, our guest here on KSJE on our local information program. So
Great stuff.
more great advice, right?
As always.
Again, he's one of those boots on the ground kind of guys who can kind of tell us what the real world is like out there.
That's right. Speaking of boots, I've yet to.
Yes, boots.
Well, I just
Okay.
I've yet to. I think about it all the time.
I'm not wearing them.
Amazing. I am, but they have this amazing spray thing. Remember, we talked to Vince last time. It was like this unique combination. I've been meaning to do it, and I'm such a slacker.
Right.
Anyway, you spray your shoes before coming inside.
Yes. Yes.
No.
That's one more thing you could do. Very true. Okay. We have another guest.
Cool.
Who is
Jason?
calling in. Good morning. You're on KSJE this morning.
Good morning, Scott and Megan. How are you guys doing?
Good. Thank you.
How are you?
Good.
This is Jason Calcote from Citizens Trust and Investment Corporation. Jason, thanks for calling in.
Hey, thanks for having me.
You bet. You bet. It's great to hear your voice. And we wanted to ask you a bit about in investing during this time. We've seen the markets just kind of go crazy and then not go so crazy. And I know this stuff doesn't bother you maybe as much as it does us.
Well, Jason knows things.
He knows
because
things.
the market
He's
is
very
created to fluctuate, right, Jason?
I mean, that's true. Market fluctuation is definitely a part of it if you're investing. And I mean, this year just started off so wild. I mean, it's hard to think back now, but we had the Hong Kong protests going on in January. Brexit was in January. We almost started a war with Iran.
Was that just January?
That was just January.
It wasn't like
That's
5
amazing.
years ago?
Yeah,
Oh, my goodness.
I just thought about that, yeah.
Okay.
Oh, it was. I mean, we had an impeachment trial. Australia was on fire. OPEC started an oil price war. All these things happening in the first quarter of 2020, and then you throw COVID in the mix, and it was a recipe for a disaster.
Right. And so a lot of people's retirement is wrapped up in the stocks and such. And so I've been thinking about just
Stocks and such.
Stocks and such.
Okay.
That's right. That's the formal.
Yeah, I know. That's a term.
That's
It's a technical
economist.
term.
That's a economics jargon there,
Yes.
Scott.
Yeah,
Jeez.
that's industry jargon.
Yeah, industry jargon. See?
Yes.
Jason agrees. Anyway, so I just been thinking a lot about this is probably impacting different age groups, right? So my retirement fund has longer than maybe Scott's, just to remind the listener.
Wait, I should have a retirement fund? What are you
Oh
saying?
my gosh, you're already behind. You're doomed.
I know.
So what kind of thoughts do you have on that as far as just individual circumstances when it comes to investing?
Well, that's hard because, I mean, at the beginning of this year, everybody was really riding pretty high on the market. Everybody was thinking Dow 30,000. You know, we had February 12th was really our peak of the year. We were at 29,550 for the Dow, and then COVID-19 hit late January, really, and the market bottomed out in March 20th at 18,500, essentially. So people that were thinking of retiring this year, it was really unfortunate for that to happen, and you kind of hope that they've gotten the right advice and they have a right mix of funds for them at their age. Most of investing, you think, okay, when you're young, you're going to be really aggressive. You've got this long time horizon to invest. And then as you get older and closer to retirement, you kind of want to be a little more conservative and start protecting what you had. So you hope that their asset allocation was a little more in fixed income than in equities, but just so hard to see something like this coming, and it hit hard and fast. I mean, this was a really fast fall.
Yeah, definitely. But you're right. And I know you have mentioned this to me time and time again about making sure you're comfortable with your investment mix. And it is all part of timing, is it not, Jason? Not timing the market, but timing your retirement. If I'm a year out or even 2-3 years out, I want to protect myself from these wild potential swings in the market, don't I?
That's exactly right. You don't want to wait until 6 months before retiring to adjust your asset allocation to something more conservative. You want to really be in front of that. And that's not to say, most people, they retire 65 to 70, and you've got hopefully another 20 to 25 years to live. So you don't want to be completely in fixed income by any means, but you want to protect yourself from something like this. Whereas someone like Megan or myself, I look at this as an opportunity. This is something where if you have a 401k or some type of retirement fund, you're investing what we call dollar cost averaging into the market, basically, where you're doing every 2 weeks and you're doing this constant amount that's the same every time. So we're actually buying when all this stuff was low. And then, if you have a 401k, there's no reason to really trade the account a lot. You want to put it in something you're comfortable with and just let it go. And you'll climb out of this thing.
Right. And for 401ks, that's usually a little bit more, maybe you're on your own kind of a thing, right? And so folks have a bit more maybe ownership of that, but then they also have more responsibility to make sure that those investments, if there's a choice of funds, right, that they have the right mix for where they are in their careers.
That's very true. They are participant directed. And that's why a lot of 401ks now offer what we call lifestyle funds or target date funds, where you've got this name of a fund and then you've got a date behind it, so you can use your birthday and say, okay, I think I'm going to retire around 65, so whatever date is closest to that offered by the funds, then you can pick that fund, and what it'll do is be really aggressive for you right now. Let's say we picked a 2050 fund, and then each year you get closer to that date, it becomes a little more conservative, and a little more conservative kind of reallocates based on where you are in your life. So a lot of 401ks offer those, and those are the ones that I like to talk to participants about, especially because most employees that are joining a 401k, they're not in the industry. They're not, this is probably their first time investing in the market. So a fund like that is a lot easier to manage, I suppose.
Yeah, that's right. And so when it comes to managing funds, obviously there are investment professionals out there like yourself, but also just how obsessively or not should we be watching what is happening? Basically, what good does it do to keep track? How often should we check in?
I mean, it's nice to be informed, I suppose, but if you've got a long time horizon, don't look at it. Just leave it alone, and it'll come back. It already has. I mean, it's climbed back to, what are we, around 26,300 today. So we've climbed out of this hole that we bottomed out in quite a bit. It's been kind of steady. It's been pretty volatile. But, as far as checking on your 401k balance every day, you can drive yourself a little crazy doing that. I would, most people get quarterly statements, and that's, as long as you're not looking at retiring in the next year or two, then that's probably sufficient.
That's enough, right?
Yeah.
I understand. And again, we talk about trying to time the market, which is never anyone's good advice, right? Because who could have predicted what happened in March, right?
Right.
I mean, don't know. I couldn't.
No.
Nobody can.
Nobody saw that kind of drop coming. It seemed like when COVID was first infiltrating the U.S., it really felt like, this is so far removed. This is on the coasts, and then all of a sudden it was everywhere.
Right. Exactly. But now the markets have kind of rebounded, which I guess says something to the stability and resiliency of the markets, at least in this country. And I haven't looked at global markets, but I mean, everything's just kind of dealing with this. And I hate to say the term new normal, but that's kind of what we're dealing with.
Yeah, and they really are. I mean, we've had, unemployment was at 14.7% in late April or early April. And just to give you kind of something to compare that with, in the Great Depression era, it was at 25%. So not quite there, but kind of in the same ballpark. And, we had unemployment, jobless claims were at 6 million in March and late April. But the market, they almost priced that in this time around. They kind of ignored that. They ignored that companies were missing their earnings by a long shot. There wasn't quite the panic in the financial markets after we bottomed out. I mean, there was that initial first scare, but since then it's been sort of this steady, yes, the numbers are going to be bad, we understand that, but we're looking at things in a longer time horizon. I think investors are not panicking this time around, and that's when you get hurt, when you sell at the bottom. You don't want to sell low and buy back in when it's climbing back up. You don't want to sell low and buy high. That's the opposite of
that's not what you want to do. I understand. Yeah. That's true. And so Jason, just a couple minutes remaining this morning. I wanted to ask you a bit about, with some of the budgets, the federal government has come through with some stimulus packages, certainly for residents and businesses and things along that line. But a lot of folks are concerned about the budget deficits and what that may do to the markets or inflation or interest rates or all of the above. Is there anything that you're seeing about what the next, 18 months looks like, the next 24 months look like? I mean, there's got to be a lot of economic pressures on the economy going forward, right?
Yeah, it's going to be interesting to see what happens going forward. I mean, we've got this whole new culture of e-commerce and technology to allow people to work from home. We've got delivery services from groceries and even dine-in restaurants that didn't used to offer that type of thing. So that's going to be one really interesting aspect of the recovery to see if this sort of, I don't want to call it social distancing, but it's kind of what it is, and it's becoming a new normal, especially if, if movie theaters start offering movies on demand and you can just watch a movie from home. It's going to be, some of those industries may not be able to bounce back as quickly as others. And then as far as a fixed income standpoint, you talked a little bit about interest rates. We just, in our portfolios, we're kind of underweighting fixed income because it's increasingly apparent that the U.S. Federal Reserve and the other major global central banks are not going to be hiking interest rates anytime soon. So I think those are going to stay low, which is, that's a concern for the bond market too, and being able to borrow. And then the equities, we're slightly overweight on equities for the long term, but due to the uncertainty, we're kind of sticking towards large cap, big stable companies, especially in the U.S., and staying away from some of the developing nations right now. And then our budgets, we're so much further in debt now after that stimulus package was, I think, around $3 trillion or something like that between the PPP loans and
right
stimulus checks. So, yeah.
And there could be more coming, right? There's more talk of more stimulus coming. So
there is. Yep, they're talking about it right now. So we'll see how the Fed deals with that. I'm not sure, what their strategy is going to be. It'll be nice to hear the minutes from their meeting this month and see what their thoughts are moving forward.
Yeah, I think that's the only time I've ever thought I would like to see meeting minutes is with the Fed.
Well, that's,
normally it's like, no thanks. But it's not like when it comes to the deficit, the federal deficit, it's not like a consumer credit card, right? It's like we're borrowing against ourselves, basically. Is that true?
In a sense, yeah. I mean, we have a credit rating as a nation that can go up and down, and that could be cause for concern. And we've got a lot of other countries that own a lot of U.S. debt, and as long as we play nice with them, that'll be okay. But China's one of the biggest players in that. So it's an odd. It's weird to talk about numbers that big and be able to relate to it at all when we're in the trillions of dollars for the government.
Very good. Well, Jason, we appreciate you putting all this in context, at least a little bit for us to understand kind of what's going on, and it certainly changes day by day. But as you mentioned, if we want to keep our sanity, we will check our statements quarterly.
That's right,
and not daily.
Yep, and just don't panic, and as long as you've got the right risk allocation for you, then you should be fine.
Okay, very good. I feel better already.
Yes.
Thank you very much.
All right. Thanks, Scott and Megan. Thanks for having me.
You're very welcome. That is Jason Calcote from Citizens Trust and Investment Corporation with us this morning on our COVID-19 program. But I know folks are obviously concerned about the ups and downs in the market. If you've got money invested or if you've got a 401k through your job,
yes.
What's it doing and how can I maximize how it could be working for me, my money working for me.
That's right. I mean, that's the gold standard.
My money needs to really step it up, I have to say.
My money.
It is not doing very good.
Slothful money.
Yeah.
Yeah, exactly. Well, I mean, yeah, because that's the gold standard when it comes to retirement. We're not using coffee cans and mattresses. We're using...
We shouldn't be, anyway.
Definitely use the market.
Right.
Free money tip. Yeah, and I mean, I listen to The Economist like every night or whatever. So I'm like obsessed with this kind of stuff.
Right.
Which is why I asked him the question, like, should I just ostrich in the sand right now, though? Is that better?
Right.
For my overall health?
And the answer was yes, right?
Yeah, right.
I mean, just
for certain people, yeah.
Not day to day. You drive yourself crazy.
Yeah, just wait it out. So, especially if it's being run by somebody like Jason or any other investment manager, that's their job.
Right.
So, yeah.
Exactly. They're the ones who can't sleep at night. We're fine. We should be fine.
Exactly.
Hopefully.
Yeah.
So, but we hope Jason's well rested too.
Your sleep.
I do. I really do. Exactly.
Hashtag classic Scott McClellan.
There you go. Thank you very much. Exactly. Yet I'm here every morning at 8 o'clock.
That's right, you are. No, you're here before that.
Well, I'm here. Yeah, I know. But on the air at 8 o'clock. So there you go. Anyway.
Tune in.
So anyway, great guests today. Great show.
As always.
Love it. And appreciate them calling in. And so tomorrow, we're going to talk to a doctor.
That's right.
On the show tomorrow. Cardiologist, a little bit about maybe COVID
shaking
and
things
heart
up with cardiologist,
health. So that'll be interesting. And then we're going to get an update from another local business tomorrow on the show. So we're looking forward to that.
As
so that's on
always.
Thursday's show, everybody. So we hope you will join us and come back. Again, every Monday through Thursday at 9 on Facebook and YouTube. At noon, you can hear us on KNMI 88.9 Vertical Radio, and at 5:06 p.m. here on KSJE 90.9 or 103.3 FM or KSJE.com. But we will call it a day today.
See you tomorrow.
All right. Have a good one, everyone. Thanks for watching.